I'm Brielle Hrubic. I'm an SVP Business Lead over at Solved. I'm super excited to be here.
Amazing. And SVP Supervisor over at Solved, tell us a little bit about your roles and responsibilities.
So I am a business lead across some of the largest pieces of business that we have at Solved. Some of my businesses focus on rare disease and some of them not rare. On a day-to-day, I'm working with the investment team, strategy, creative, to bring the strategic initiatives from our clients to life through media.
So shifting into the panel topic for today, let's start bigger picture. How has CTV been changing the way you think about engaging with HCPs and patients?
Yep, so we are shifting from broad awareness really to audience-first messaging. So typically in healthcare, we're thinking of the storytelling aspect of video. And so you still have that aspect, but you have the added precision and measurability of CTV, where you don't typically have that within traditional linear.
Right. So there's a lot of conversation about supply quality within healthcare. Where do you think the industry still gets it wrong?
I would say treating supply as equal. So there is a ton of difference and inequality in between premium, open, and direct. And so what's really important is making sure you're grounding the plan in premium environments and layering on the reach aspect. So you're getting to who you want to speak to, when you want to speak to them, where you want to speak to them, contextual obligations. And we also want to make sure when we're grounding them in these premium environments, we're focusing on the appropriate environments where we're speaking to them versus being disruptive, which is really important, especially in our rare diseases.
How has your team approached CTV strategy differently than just the traditional throw it on the plan model?
So we really have to treat CTV as less of a tactic and more of a strategic pillar, right? So where is it falling? You look at the audience, where is it falling within the overall ecosystem? This is especially important when we're thinking about this because in healthcare, we want to make sure we are sensitive with our patient audiences,
right?
And really speaking to them where they want to be spoken to, how they want to be spoken to.
You hear the phrase curated health inventory a lot. What does that actually mean in practice to you and your teams?
I would say being as intentional as possible. So really focusing in on premium publishers, medical environments, really just intentionally speaking to the patient audiences or the HCPs, whoever we're going against, and thinking about curation. It's really going to continue to evolve. And so quality is going to continue to change as audience behaviors change.
When it comes to tying CTV back to real outcomes, so script lift, brand impact, patient starts, what do you think needs to change?
So this is difficult because the process from exposure to leading it back to is CTV driving this is difficult to track back to. So we really do need to focus on patient outcomes. Is it RX data? Is it patient starts? Is it HCPs writing more scripts? It's a long process to get there, but that's definitely what we need to work on.